for medical graduates who are applying into residency, do you think participating in quality improvement projects, does that make the application stronger, you think?
Right. So when we talk about QI compared to traditional research, will it be helpful in making CV strong, whether it's a residency applicant or fellowship applicant? Answer is capital yes. 110% will be much more effective than traditional research, number one. Now, the problem is here. When we talk about QI projects, it requires your presence in the institute, number one. So the international medical graduate barely get the chance to do hands-on observership. Research is way far. Why way far? Because people don't match in April and then they wake up and then September is coming.
Right.
And quality improvement project is not something you can do it like boom. You need to be the part of system at least for a year or two. Then you know this idea that what is going on. You can be the part of few quality improvement projects which are already going on. You learn from that QI project and then you can tell that I want to be one of the co-PI or co-author of that particular project. So next QI project when you are submitting, make sure I would be the part of it.
Absolutely.
But by the time they will reach to the next project, finish the project, analysis, completion, publication, application season is gone. So will it be a good to CV? It's a completely new asset that you are bringing to the program. Completely new thing. Program will love to have residents or fellow who is having QI related experience because it's a great asset to the program. Actually, they are bringing those new innovative things to the program. But will it be possible to do it over certain amount of time, which is 6 months? Answer is no, it's not possible to do that. And having knowledge of QI is also enough that you are having a knowledge of QI. You are a part of the project, probably you did not able to publish it or you did not make it, it's a different story. But if you know it, that is even enough for, according to me at least. It's not a quick publication at all. It's not. So it will not improve the publication section of any application of ERAS or AAMC of resident fellow or anyone, but it will improve the CV in terms of 6 months of dedicated experience. So some of the physicians ask their team. Sometimes even I prefer to ask my colleagues and my friends and my students that, will you be giving commitment to work with us for a year with dedication? If answer is yes, then you can rely on them and you can teach them all the skills.
Right.
So that is the issue.
I understand. Yeah. So certainly, like you're saying, because the QI studies, they originate in the hospital, so that's why or the clinic, and so that's why the medical graduates, they have to be there in person to at least to get started and do all the data collection. So that's kind of very new information. I mean, like I mentioned, I heard QI so much, but just now talking with you, and now I realize how wonderful it can be for really strengthening the residency application or the fellowship application, like you mentioned.
Yes. For fellows, it's definitely great. I mean, the fellowship applicant, because you will be having 4 years in the hospital. Means if you are in 4 year or 3 year on an average, first 2 year, 3 year, if you are doing such project, not only it will strengthen your skill, it will sharpen your skill, but once you become fellow, you can ask for additional grant of NIH or AHA or AAN, or so many grants are there. You can ask the grant and you can emerge as a new young principal investigator when you are trying to go through for assistant professor level of career and tenure track positions. So for them, it's a wonderful opportunity. QI is covered under grants and commissions, so you can ask for those grants from all over the different institutes in US, outside the US. There are many institutes who are really love to fund you, but the only thing is that it's a process, it's a journey, it's not a snapshot. Traditional research, retrospective research, or cross-section is like a snapshot. Right. 1 month project, project is done, written part is done, you publish it, probably 2 month, 3 month hard work, and you will yield publication.
Yeah,
This is not that snapshot. This is a gradual process.
I hear you. Yeah. And it makes a lot of sense that, just kind of understanding the whole QI process, it certainly is very important for the academic, for people who want to pursue an academic career. But even in private side, I guess, I'm sure there's always a lot of, interest, or I'm sure there's going to be a lot of issues that come up in the delivery of care that, probably QI would be the way to resolve some of them.
Yes, yes. So people think if you are doing private practice, research has no role. That's not true. If you are in academic, research is having a huge role, definitely. But if you are having a private practice, still quality improvement type of projects are having very huge role in terms of saving a lot of cost for the maintenance of the setup. Maintenance of the setup. Sometime you realize that after having extensive knowledge, you could earn more, but because of your wrong billing and coding technique, you are losing the money.
Yes.
That is most important. People think I will increase 20 patient to 30 patient in my private practice, or 50 or 100 or 200. Keeping nurse practitioner, physician assistant will increase the patient. You can also increase the quality of the work, look into the same patients and make sure your billing coding errors will reduce, your burnout reduce. Same people has to work less and can improve their psychological health, so they can focus more on your work rather than other activities. So QI project will help private practitioner too. And not only QI, even the research will be helpful, because if you are having research, that means it will go to your private company's your profile, right?
Yes.
So when I'm Googling that I need XYZ physician in my community, and you can see their profile, and they are not only a good clinician, they are researcher, and they try to implement their evidence-based medicine. That is something important, because telling I follow evidence-based medicine rather than telling, so if I'm having publication record or presentation record, so I can even prove that I'm having and I follow by heart this evidence-based medicine concept, basically.
Absolutely. Yeah, so my dream QI project is getting scribes and basically showing in improvement in physician satisfaction, because all the documentation, all the notes are done by the end of the day, and hopefully one day I'll be able to do that QI study.
Yeah, that is a good idea, actually. There are many studies that people are currently doing in the outpatient, and it's a whole different concept when we talk about QI, and it has different role in outpatient as well as inpatient, right, private practice as well as academic practice. So it's depend on what you wish to achieve. Always side by side, if you are doing some this type of research, it will help in several ways. So probably it's always good to have such evidences with you.
Absolutely.